Hello, everybody. I hope everyone is really well today. I wanted to put this very important information out there, very important for women. Actually, this was recommended to me by a client that this information is so important, I should put it out there. So here we go. I hope you find this helpful. So I did a post a couple of days ago, 2 days ago, in my Facebook biohacking group, and it was basically about a product called Prempro, which a lot of women get prescribed for hormone therapy, especially postmenopausal. And in that post, I attached a study. Well, it was an article that contained a lot of studies, basically stating that, hey, Prempro has been shown to quadruple a woman's chances of breast cancer. So then, of course, that got a lot of attention. A couple of people private messaged me, hey, I'm taking that. But this then also led to this conversation with my client about a product she's taking called Vagifem. So let's go back first to the Prempro product. So Prempro is hormone therapy that is prescribed to a lot of women, not just in Canada, the States, across the world. And if you want to look up this article, and it has all the citations attached, this article is done by the Women's Health Organization. So it was done by the National Women's Health Network. It's titled Menopause, Hormone Therapy, and Breast Cancer. And in this article, it specifically looks at Prempro. So, Prempro, if you haven't heard of it, it's a combination of um, Premarin and Provera. A lot of people will have heard of Premarin, I think, because it also has been used in the HCG diet. Premarin is an extract of pregnant mare's urine, so it's an isolated form of estrogen. Whereas Provera, also known as medroxyprogesterone, that's a synthetic form of progesterone. It's not identical to the female's progesterone, or a woman's progesterone, or even a human's progesterone. And in this article and in the post, I basically mentioned, hey, like this product can increase chances of breast cancer. And based on the research cited in the article, part of that being, on July 9th, 2002, officials from the National Institutes of Health announced that one form of hormone therapy, Prempro, was found to cause breast cancer in previously healthy women. These women were volunteer participants in the Women's Health Initiative, which was a huge, large, long study done on many women, the longest trial ever on estrogen therapy. And the health industry knew about this. The pharmaceutical industry have known since like the 1930s that estrogen and specific forms of estrogen are toxic, they're poisonous to the female body. But this trial, the Women's Health Initiative, was specifically done on estrogen therapy and hormone therapy. And what they established was that it increased, specifically, half of the trial participants were given an estrogen progesterone combination in the form of Prempro, and the other half was given a look-alike placebo with no active ingredients. So Prempro is a combination of a synthetic estrogen and the same with progesterone, synthetic progesterone. By the time the trial was stopped, women had been taking their pills for an average of 5.2 years, which is very long. During that time, 166 women taking the hormone combination developed invasive breast cancer, compared to 124 women on the placebo. So it's quite clear of the connection there between Prempro and the breast cancer. And I don't think there's anyone nowadays that hasn't been affected by breast cancer. Someone they love, themselves, someone close to them, friends, family, like we all know this is on the increase. So this information is important, and it's important that we share it. So What they alluded to was there was an overall increase of 26%. And another way of expressing the increased risk caused by Prempro is that each year, among 10,000 postmenopausal women taking estrogen progestin, 8 more will have invasive breast cancer. This increased risk of breast cancer does not appear until the hormones have been taken for at least 2 years, so that's important to recognize. And it also appears that the risk continues to increase with longer risks. This is obviously concerning because a lot of women are using this worldwide. So if you know someone, please share the information. But this then led on to the conversation of the other product, Vagifem, which gets prescribed to women a lot for vaginal dryness and pain during intercourse and the regression of the vaginal tissue with aging. Now, let me just clarify, you don't need to be postmenopausal to receive this prescription. And you can start experiencing these symptoms in your early 30s and therefore be prescribed Vagifem to address these issues, which can be quite painful. So I understand why these are getting prescribed to help people, but that doesn't mean they come without risks. So let's just take a step back first to understand the estrogens, because this is important that you understand the hormones that are in your body. So, your body produces three types of estrogen. Most people associate estrogen with the female hormone or the most feminine hormone. Um, so, these three, we've got estradiol, estrone, and estriol. So, estradiol is the strongest of the three. And this one is the one that's most associated with cancer. This is the one that's mostly found in the likes of Prempro and uh, Vagigel, Vagigel and a lot of other hormone therapies. So the next one then is estriol, Estriol, and that is the weakest, and that is not associated with cancer, especially when we're using progesterone as well, a bioidentical progesterone to offset the effects. And then the third one is estrone, and that's not usually ever considered for hormone replacement therapy at all. It's just too weak, it wouldn't be effective. Um, so, estradiol is the estrogen that's most commonly prescribed to women in menopause. However, there are some considerations to be had here because if you take estradiol and you already are at risk based on different biomarkers, different health biomarkers, then you could be increasing your chances unknowingly of having some sort of issue with cancer in the future. And I don't like to talk about cancer, but it needs to be known. So so a couple of examples where estradiol may not be a good idea to take if you have excess body fat. So if it's evident that you have an abundance of fatty tissue and maybe you've done some hormone testing and the hormone test says you're still making your own estradiol added to the body at that stage is probably not a good idea. Fat cells do make their own estradiol, so the body will make it. Like the female body continues to make estrogen through the whole life cycle, even post menopause. Then, if a woman has any fibrocystic disease of the breast, they shouldn't be given estradiol. If they have any issues with ovarian cysts, they shouldn't be given estradiol because both types of cyst can become malignant. If the mother had breast cancer, this alone is a contraindication for prescribing estradiol. And then, even taking estradiol, and I've done a couple of posts on this recently, estrogen can lower thyroid function and the metabolism. It will reduce core temperature. So taking estradiol can predispose a woman to gain more weight. And obviously, most women are not going to be happy about that. So with all these kind of contraindications, like Estradiol is the one hormone that most women don't need. Now, there is an exception for a woman who's very slim and very lean, and if she gets her estradiol levels tested and they're very low, she could potentially benefit from a low dose of compounded bioidentical estradiol. But we would also use bioidentical progesterone to offset any negative effects of that. Now, when we get to the conversation around Vagigel, which is what I was talking about with my client, so Vagigel, like I mentioned, being um, it's pretty much a lotion or a gel that gets massaged into the vulva or up the vaginal canal. You can insert it with an applicator, and that then will it helps with replacing estradiol, but not necessarily in the way we want it to. So what we're looking at in the Vagigel is that Vagigel does contain estradiol, and many women are inserting that directly into the vagina and massaging it around the vulva to help with vaginal dryness. So Vagifem contains, and you can Google this, you can Google the Vagifem ingredients. So Vagigel is, or Vagifem, don't know why I call it Vagigel. It's a gel that you insert. It's estradiol vaginal inserts. And in these, it specifically contains 10.3 micrograms of estradiol hemihydrate, equivalent to 10 micrograms of estradiol. And women are using these daily, especially if you're not cycling anymore. Women are not just using it for the first half of the cycle, they're using it for their whole cycle, and they're inserting this directly into their body. This obviously a concern because this is direct insertion of estradiol into the body, which then puts it pretty fast into the tissues and the bloodstream. Now, if you also look up side effects for Vagifem, it's right there on drugs.com. Estradiol may increase your risk of developing a condition that may lead to uterine cancer. Report any unusual vaginal bleeding right away. Using Vagifem can increase your risk of blood clots, stroke, heart attack, or cancer of the breast, uterus, or ovaries. Alarm bells should be going off right now. This is really concerning. I'm not recommending anybody stop whatever they're doing, but I am trying to help people be educated and now go to your doctor and approach them with this information. It's right there. The research is right there. You can find it. This is not hidden information. Um, and I can understand that doctors don't necessarily have the time to look up every product and they have so many patients to see in a day, but regardless, this is very important information if you're going to be prescribing it to women, especially if we have the compounding effect of all the other environmental factors that are also increasing um, breast and uterine and cervical cancer and whatnot in women. Like, this is something to be considered. There are alternatives. There are alternatives like estriol. You can get bioidentical estriol, EST or IOL, which is the safer form of estrogen. That can help with vaginal dryness. That can help with the tissue. Alongside, you can use vitamin E, extra virgin olive oil, awesome option for vaginal dryness. If you want to offset any potential side effects of estrogen, whether or not that's an estrogen you're taking into your body or the estrogen your body is making itself. Easy way to do that, that's going to be bioidentical progesterone. Progesterone deactivates the damaging effects of estrogen. The pharmaceutical companies and the health industry has known this for almost a century. They probably knew it for longer. Back in the 1930s, the research started coming out about the damaging effects of estrogen, and the positive effects of progesterone were well known at this stage, but it didn't fit the financial agenda, shall we say. So again, the female body will produce estrogen right through the whole life cycle, especially if you have excess body fat. Then we've got the whole context of xenoestrogens coming in through our diet and in the environment. One way, like I mentioned, to offset that is progesterone, bioidentical progesterone. But this information is really important to know. You can find this research. You can, if you go look, I post a lot of research. I cite a lot of what I say. I post about hormones almost daily on my Facebook and Instagram stories. I've posted a lot in my groups. I've done a load of hormone podcast episodes. I had an awesome interview with Dr. Michael Platt about this. I had a great interview with Dr. Eldon Dahl about this. So this information is out there, but people, they're just not being told, I suppose. They're just not being told, and this is really, really important. This can even be go back to the whole idea of birth control. I've spoken about birth control. I did a podcast episode on birth control. But the older you get, the more at risk you are. So women who are being prescribed Prempro and Vagifem, and even as my mind wanders, I know some clients who are taking Prometrium, which is a synthetic form of progesterone. It's not bioidentical. So if you're thinking, well, the prometrium is going to offset the estrogen that I'm taking in, well, prometrium has been shown to only stay in the serum. It doesn't attach to progesterone receptors. So you've progesterone receptors all over your body. Progesterone and the thyroid and metabolism, they're intricately entwined. When progesterone is low, thyroid's usually suffering, and so is metabolism, and vice versa. But with prometrium, because of the way it has to get metabolized, it stays in the serum. So if you go back to get a blood test after taking prometrium for 2 or 3 months, it's going to look like your progesterone levels are normalized or they're high, but that's not an accurate reading of the actual progesterone in your body that's active, that's actually doing the work. Because again, prometrium stays in the serum. We want our progesterone to attach to the progesterone receptors in the tissues in the cells so that it can be active and do its work. Um, but I think that's enough of that. I've spoken a lot. This was not put out to be any sort of fear mongering or anything. This is purely for educational purposes. Do with this what you may, but I hope you learn something and maybe will approach your doctor if he's prescribing these products to you, and say, hey, what do you think of this? You can even bring the article to him, print it off.